Hi, this is Nurse Tina from Johns Hopkins Hospital. I would like to educate you on the medical issue of hyperhidrosis and talk about how people deal with it. Hyperhidrosis or excessive sweating affects 2% to 3% of Americans in the underarms or of the palms and soles of the feet. Sweating is embarrassing. It stains clothes, ruins romance, and complicates business and social interactions. However, people with overactive sweat glands have to face this reality. The body uses sweat to regulate internal temperature. Some people have abnormal sweat glands in the armpit, feet, and hands, which cause them to perspire like crazy. Emotions also cause the sweat gland to release sweat. It can even be more of a problem when bacteria mixes with the sweat because it can cause a huge odor. This is a huge problem for the person in social occasions. The main solutions people use for sweat is deodorant to reduce the odor and antiperspirant to reduce the amount of sweat produced. High aluminum antiperspirants are perfect because they block the sweat glands. People even goes as far to ask their dermatologist for antiperspirant that has 30 to 45% aluminum. The most effective use for the antiperspirant is before bed in massaging the antiperspirant on the skin. In the morning, once the product has been absorbed in the sweat glands, apply more to the area. Other solutions include avoiding cloths like nylon and polyester that raise body temperature and trigger sweating. Cotton, linen, or silk will allow sweat to not only evaporate but also allow the body to feel cool. Wicks moisture off skin. Another solution to prevent sweat is to changing diet to not include seed-inducing food items. Onion, alcohol, caffeine all trigger sweat. Sometimes sweat even can indicate a disease such as hyperthyroidism, heart disease, menopause, etc. Always discuss with primary care physician if you believe sweat can be attributed to one of these causes. A simple solution people use is a high-quality undershirt. They can't be discerned from the outside and do a pretty good job hiding the sweat. If you combine this with the antiperspirant, the sweat and odor is blocked pretty well. There are even medical options for excessive sweat such as Botox injection into the area of excessive sweat. This will block nerves that stimulate sweat. In extreme cases, people even get their sweat glands removed. But what more can be done? Is this an issue that affects your self-confidence? Does it prevent you from meeting new people? Click on the link below to learn more. You won't be disappointed.